The Gauteng Department of Education says it's finalising processes of ensuring the safe reopening of primary schools to full capacity for the next term. The department says over 2,000 schools have been affected by COVID-19 infections since the start of the pandemic. More than 1,000 pupils are said to have tested positive at public schools in the province in the past weeks. The province is already experiencing a third wave with an average rate of around 3,500 new infections recorded per day. Well, for more, we're joined by Gauteng Department of Education spokesperson Steve Mabona. Thanks very much, Steve, for joining us. I've just outlined there in the introduction that we are in the third wave, and you have also reported that 1,000 pupils have been infected in the past weeks or so. And yet you guys are insisting on going full force with reopening schools. Why?
No, it's because we've been making necessary preparations for the primary schools to come back. You will know that according to our researchers, we have lost so much of your curriculum time. More so that at that level, they need supervision, they need an educator in front of them. So that's why we are finalizing our preparations. But in the current wave or third wave that we are in, we are working very closely with the Department of Health. We are expert-driven. We are taking advices. And the officials, when they are interacting with our schools, taking in cognizance the number of cases that are reported, they then will be advised on whether to close a school or to move online, or to continue, probably isolate a few people. So we are working very closely with the Department of Health.
So going forward, when the schools are reopened and there are cases, how many cases would you need to have in a primary school before you decide, right, let's shut down a school? And on top of that, if, say, a staff member or a number of staff members fall ill due to COVID, do you have other resources that you can pull on to be able to take over?
Yes, indeed. Remember, our decision is based on what professionals would have advised us coming from the Department of Health. So they don't just look at the numbers, they do an assessment, look at an environment on how many cases they have. But on top of that, they also look at those that contacts that they must, isolate, and look at the probably number of classes that are affected. Then they make that call. So they actually lead this process of saying, yes, according to the number of cases and what we have done on the ground in terms of the assessment, we think that we need to close. It's not only based on one case or two cases or more than that, and then you close. There's an assessment that they conduct, working very closely with our officials, and make that call. So in the event there's a case and someone will not probably come for quite a sizable amount of time, we will then, invoke what we call substitute teachers. But you know that with COVID, people will go probably for 7 or 10 days and then they will come back. And we're monitoring very closely. And there are those with the comorbidities, those who we, have our substitute teachers that will replace them in the interim while we are waiting for them to come back.
Do you think we're doing better this year in terms of handling the COVID-19 pandemic than perhaps we handled things last year from an education perspective?
Yes, from an education perspective, we're doing better. Because remember, previously, once we have one case or two, we'll shut down the school for 7 days or for 10 days or even more without probably conducting an assessment that will assist you to make an informed decision. To a certain extent, the assessment that is made by Department of Health assists us because they then advise you on what to do. And you'll also recall previously that parents will demand that the entire school must be decontaminated, we must clean and make sure that everything is ready. But now, because we've learned so much, about this pandemic and the virus itself, that the contamination, you can focus on where the positive case or the positive person was around at, and those that need to isolate that probably they were at, and you focus on those areas and then make sure that you do what is necessary in terms of decontamination, unlike you having to spend a lot of money on the entire school only to find that there's no need for you to do that.
Yeah. Steve, when do we know, or when are we expecting teachers in Gauteng to start being vaccinated? I know that we're in phase 2 and that's really for the elderly and people with comorbidities, but when are we expecting teachers to be inoculated?
Well, that's the process of Department of Health. They should be in a position to give details when they are ready. We are ready to support them because remember, from our perspective, we need to make sure that educators are given space to go through that process. But as soon as the Department of Health is ready, they will then inform on how we're going to be managing. But yes, indeed, we will be supporting the process because we are talking about our educators.
Indeed. Thank you very much, Steve, for your time. Steve Mabona, he's the Gauteng spokesperson for education.